we're going to talk about these difficult sites, which unfortunately you probably are aware of. I've had an opportunity to work in this environment for 20 plus years now, working across the spectrum in terms of support we have within our industry, and then working through different therapeutic areas and different types of products and, you know, private and academic and public and all those things. So getting an opportunity to kind of see the good and the not so good, both domestically and internationally. And unfortunately, a lot of the ways that we are non-compliant, that we find our investigators not being compliant, aren't reserved just for us here in the States. We see the same sort of things internationally as well. What we're going to talk about is, you know, what makes a difficult site. We're going to look at how we engage those sites and how we define them, because, you know, a monitor's or a CRA's difficult site might not be a medical monitor's difficult site. So we'll talk about trending techniques. So one of the things that we want to be mindful of, and one of the things that I always encourage my clients when I'm trying to get them back on the straight and narrow path, is because you guys need that backup, you know, reinforce what is expected so that you guys can go out there and say, these are the expectations for you. And we have a predetermined non-compliance policy investigator. You know, we've put a lot of effort into developing this protocol and giving you the resources that you need. And we want to make sure that giving you all the information you need to properly conduct the study, which is our regulatory requirements. So we're going to find things, we're going to address those with you, and the expectation is you're doing your part to be compliant. We're not going to be able to do it for you. I always tell monitors, when you whip out that 3-hole punch and start putting together their reg binder for them, it is over for you, because they're just going to let you go through and flag those CONMEDs and SAEs and AEs without having to do the effort, because they know that you're going to do it for them, unfortunately. Yeah, it's frustrating, but it's also, when you step over that line, it's clear they're not doing their job, right? And so we've also, you know, put them in a position, and I think, unfortunately, at least over the years, we have tried to sell these clinical research as a turnkey operation for investigators. Oh, you don't really need to do much, just sign some forms, maybe see some people, the study coordinator and the monitor are going to handle everything, without them really understanding what's required of them. And then when the FDA comes and holds them, you know, to that 1572, for example, where it says, warning, you know, a willfully false statement is a criminal offense, then they blame the monitors. And the study coordinator's like, no one ever told me. That's where you whip out that report. You're like, that follow-up letter. Yeah, I kind of did. So, and it's important too. And again, I want everyone to be compliant, but we want to make sure that we have this system of shared responsibility, and we have to do our own part, and we help each other through that. So monitors are in a really weird position in that you have to be compliant, but then your job also really is to make sure that other people are compliant too. And sometimes that's not always easy, right? Especially when you're kind of a rock and a hard place. You might not have selected this person, and I believe there should be a bounty hunting service for monitors that go and select sites and they don't actually monitor them. But
that's the best way I've ever heard it put.
Sorry. It's rude. and then you find issues like you're supposed to, and you escalate them, and you're told, just make it work, right? So it's really difficult. I fully appreciate that. But the light at the end of the tunnel then, or at least this beacon, is that the FDA has turned the information that we provide as monitors. And certainly I'll tell you as an auditor, when I'm auditing, I'm looking at monitors as well. I'm looking at the CRAs as well. And when we get to those monitoring reports that say, hey, this guy's not doing what he's supposed to be doing, you know, they're not compliant, blah, blah, blah. But then the follow-up letter says, thank you so much for all your hard work and effort. It's a pleasure working with you. We are not meeting our own regulatory obligation of giving that investigator all the information they need to properly conduct the study. So we have seen where the FDA has taken information from monitoring visit reports and follow-up letters and said to investigators, no. This is repeat and deliberate noncompliance. You were aware of it and you moved forward. Now, the sponsor of the CRO might be held for failing to secure compliance, failing to ensure proper monitoring, but the FDA is very clear, again, on that, the overlapping responsibilities. I think it was a Dr. Aqua. I always say he sounds like a superhero until you read his warning letter, but he blamed everybody else, right? Oh, well, the monitor and the CRO said I could do this. They're like, okay, fine, but you have responsibilities that you were required to meet. So I personally think we do ourselves a disservice when we're not aware of the requirements and we're not holding one another to them.